In this chapter, you will be learning about emotion, stress, and health. I'm your guest lecturer, Donna Shu, and I'm going to be talking about stress and ways to cope with it. I like to start off with a little humorous cartoon here. The cook is yelling out, "Is there anyone here who specializes in stress management?" And I'm sure you have felt that way, overwhelmed with all of the multiple tasks that you have in your life. Perhaps you're working full time, maybe you're, managing a family, and then you've got school, obviously. There are different kinds of stressors in our life, and I would like to start off here talking about what stress actually is. It's a process by which we perceive and then respond to certain events, which we call stressors, that are typically threatening or challenging. We can have stress that, for example, are catastrophes, significant events in our lives like earthquakes or storms or floods. Perhaps the stress can be various life changes, maybe a job loss, perhaps a divorce, but it also can be a happy thing, such as getting married. These different events can create stress as we have to adapt to change. And then, of course, there are daily hassles. Everyday little events that are irritating. These are negative things that we have to deal with, such as taking out the garbage or dealing with a roommate that's not very cooperative, or perhaps you have to deal with a million emails in a day, or people who are, talking loudly in class. Things that are annoyances, and they take their toll because they're grinding on us. When you are under extreme or prolonged stress, that can cause a lot of problems. I'm sure that you're aware of many of the medical concerns that can happen. And I'm going to encourage you to read in your textbook about stress and heart disease and the response of your body to your immune system and various other medical problems. What I would like to focus on, though, is ways to help. One of the most positive things that we can do is have a social support network. This can help us fight illnesses in two ways. Number one, it calms us. It lowers our blood pressure and all of those stress hormones that are flowing in our body. And it also fosters an immune system response that's stronger. Think about when you were supported by others during very difficult time. Simply the act of being able to talk to somebody can reduce your stress level. Being connected. In addition, a close relationship can give you the opportunity to, heal very painful feelings. You're not alone. You have found, solace in other support networks. Another very important way to reduce your stress and cope with stress is exercise. I cannot emphasize this enough. Aerobic exercise is a win-win-win situation. Exercise adds to the quality of your life, adding years to your life, and also to better mood and enjoyment and quality of life. There are many research studies that show that active people have a better mood, longer lifespan, and have more vigor. People who are depressed exercise less. They're more fatigued, and they really, increase chances of prolonged depression and anxiety. If you exercise vigorously, even a 10-minute walk, you're going to have an ongoing effect of about 2 hours of increased well-being, increased energy level, and lowered tension. Exercise works like an antidepressant drug. Exercise is one of the most positive things that we can do. It increases energy, it calms anxiety, and it boosts your mood. Another way to help with stress is meditation. I would like you to read carefully some of the studies about meditation. As I've summarized on this slide, there's relief from headaches, reduced blood pressure, reduced anxiety, and insomnia. Mindfulness meditation is something that's been in the popular literature. If you were taught this technique, you would relax and silently attend to your inner state. Close your eyes, scan your body from head to toe, and zoom in on different parts of your body and the response of your body to stress. During the whole time, you're aware and accepting. You pay attention to your breathing and attend to each breath as you help yourself relax. Studies have shown that people who have had heart attacks can reduce the risk of future heart attacks through relaxation training. The last thing that I want to discuss is your faith. I think this is very interesting. People who are involved in religious activities tend to live longer than those who are not religiously active. There are many factors here. A person who might be involved in a religious activity might have healthier behavior, maybe less smoking and drinking. Perhaps they have, again, a factor of social support. And then also the positive emotions, hope and optimism that can reduce anxiety and stress. All of these things can lead to better health and is a possible explanation for the correlation between religious involvement, health, and longevity. I hope this little lecture has helped you understand some positive coping mechanisms for stress, and I encourage you to read the rest of the chapter for the research behind all of these major ideas.